Okay, hi. Yes, my name is Yasmin, and this is my heart disease, uh, the heart disease project. So the first part is part one, panic, and and it says how likely is it to be a heart problem, asthma, panic, or panic attack, or I said it's unlikely that it's a heart problem. The problem is most likely a panic attack because of the symptoms of cold sweats, difficulty breathing, and intense fear, because those are often associated with panic attacks. The second question is, why do you say this? What are the symptoms that are consistent with your preliminary diagnosis? Is there anything unusual? The one unusual symptom was no chest pains, which is usually associated with heart problems. For part two, a voice from within. It says to draw a sketch of of the heart and show where the coronary blood vessels lie. So, um, I drew this little diagram. So, it's kind of bad of the heart, but right there is the right coronary artery. Right there, somewhere around here, is the left main coronary. Right here is the left anterior descending artery, and then like right there in this little area is the circumflex artery. Okay. Then the second question is list and order the blood vessels that a drop of blood will follow as it makes a complete journey around the body, starting as it enters in the right atrium until it returns to the left atrium. So the blood vessel journey, it goes to the right atrium, the right ventricle, pulmonary artery, lungs, pulmonary veins, left atrium, left ventricle, the aorta, the systemic circuit, then back to the right atrium. What are the characteristics of Denise's lifestyle that might lead to a heart problem? Denise's lifestyle characteristics that may lead to a heart problem are smoking, lack of exercise, high stress, high cholesterol, poor diet, and obesity. And number four, how has Denise suffered a heart attack? I said I think she did suffer a heart attack. And then number five is define these terms: cholesterol, hypercholesterolemia, cardiac ischemia, collateral vessels, angina pectoris, and plaque. Okay, so hypercholesterolemia is high blood cholesterol levels. Cardiac ischemia is inadequate blood supply to the heart muscle, often due to narrowed arteries. Collateral vessels, small blood vessels that form to bypass blocked arteries. Angina pectoris, chest pain or discomfort due to reduced blood flow to the heart. Plaque, accumulation of cholesterol, fat, and other substances in arteries, causing narrowing and reduced blood flow. Okay, so part three, heart attack basics. I didn't know. There was no questions on that one, so I didn't know if you wanted us to do anything. So I kind of just skipped over it. So part four, call 911. The first question. First question. Why? Well, okay. Why is the first hour of heart attack most critical? The second question. Why do fibrogen, C-reactive protein, and interleukin 18 indicate? What do it? What is the cause of Denise's breathless fatigue and nausea? What are the platelets and what do they have to do with Denise's heart problem? What is the embolus and what is its connection to thrombosis? What does LDL have to do with the heart attacks? How does hypertension develop, and what does it have to do with high risk of heart attacks? I kind of put it all in one. So Denise's heart attacks is a culmination of several risk factors: chronic inflammation, high LDL cholesterol, hypertension, and potentially genetic predispositions like an issue with her LDL receptive gene. All of these factors lead to the rupture of an unstable plaque in her coronary artery, triggering a clot and eventually blocking blood flow to the heart. Her symptoms of breathlessness, fatigue, and nausea are consistent with the cascade of events. Quick intervention in the first hour is crucial to limit heart damage and prevent complications like embolisms. And part 5, it was just emergency room, just like her talking to the doctor and like him giving a little pamphlet, so I did skip that one. Part 6, the aftermath. Okay. So question 1 is, what foods says nutrients should be limited, and specifically what foods says nutrients are beneficial and why? So saturated fats. Why is my stuff not together? Okay. Foods as nutrients to limit are saturated fats, trans fats, refined carbohydrates, excess salt, processed meats. Foods and nutrients to include are monosaturated fats, omega-3 fatty acids, fiber, potassium-rich foods, plant-based proteins. Now, the why or the benefits is because saturated fats raises LDL and increases the risk of atherosclerosis. Omega-3s reduce inflammation, lower triglycerides, and improve heart function. Fiber lowers LDL and helps manage blood sugar. Potassium helps balance sodium, reducing blood pressure, and plant proteins are low in unhealthy fats and high in fiber. Second question, lifestyle changes. What activities are hazardous to heart health, and what are some solutions? Okay, what the activities that are harmful are smoking, excess alcohol, chronic stress, overeating, sedentary lifestyle. Well, smoking is obviously bad because it can blacken your lungs. So basically, solution is either, I've heard of nicotine patches or counseling. Alcohol, if you do indulge in it, at least have at least one. But some say it's different for men and women. Some would say women should have one a day. Some say men could have two. Stress management, for your chronic stress, just practice relaxation, like yoga, meditation, maybe listening to music, be in like a calm setting. For overeating, healthy eating habits like eating balanced meals, following my plate, and avoid overeating. For the solution for sedentary lifestyle would be just increase physical activity. Just go outside to do something, go take a walk around the neighborhood, stuff like that. What are those are benefits. At number 3, aspirin. How can aspirin help in preventing heart disease? Okay. So, aspirin can help in preventing heart disease by thinning out the blood, which reduces the likelihoods of blood clots forming in your arteries. Also, for people at risk of high heart disease or who have experienced a heart attack, a low-dose aspirin regimen may be recommended to reduce the risk of secondary heart attacks or strokes. It also works by inhibiting the platelet aggregation, preventing them from clumping together, and blocking blood flow in the arteries, which can reduce chances of thrombosis, which is clots. Okay, so number 4, it says to draw a diagram of the changes in blood enzyme and troponin levels that occur before, during, and after a heart attack. So I didn't really label it very good, but I drew a little and like a little thing with like the little levels and the numbers on the side. But I guess I can explain it. So before a heart attack, you have low troponin levels, you have a low creatine kinase, and a low myoglobin, which is a muscle protein. During a heart attack, you have high troponin, elevated creatine kinase, and an elevated myoglobin. 1 to 3 hours after a heart attack, you have a rapid rise of troponin, peak levels of creatine kinase, and a rapid rise of myoglobin. 24 hours after a heart attack, you have high or peak troponin, and your creatine kinase returns to normal, so it fades a little bit, and your myoglobin normalizes, like it just goes back normal. 48 to 72 hours after a heart attack, your troponin decreases, your creatine kinase normalizes, and so does your myoglobin. And then it says to create for number 5, create a pamphlet that the doctor could give to Denise about altering her lifestyle. It should include information on smoking, cholesterol, blood pressure, obesity, diabetes, physical activity, diet, and stress. So, I made a pamphlet. Called Altering Your Lifestyle After a Heart Attack by me, Yasmin Prelude. So, this is the inside. So this is kind of what it looks like. I know my handwriting is so bad. I tried to draw a picture, but I couldn't draw a picture following me. But what it says is, stop smoking. Smoking is a major risk factor for heart disease. Quitting reduces risk of heart attack, stroke, and lung disease. Lower your cholesterol. Eat a healthy diet, low in saturated fats, high in fiber. Consider cholesterol-lowering medications that are prescribed by doctor. Manage your stress, practicing relaxation techniques, deep breathing, yoga, meditation. Prioritize hobbies, rest, and socialization. Exercise regularly. It says to aim for at least 150 minutes of moderate activity. That don't have to be like each day. That could be like throughout a week. It strengthens the heart, improves cholesterol levels, maintains a healthy weight. And then control blood pressure with regular exercise, low salt diets. Manage your weight, eat balanced meals, exercise regularly, because overweight and obesity can increase risk for heart disease, diabetes, and high blood pressure. And regular checkups are also a good thing for you to do, because you can regularly check up on how your blood pressure, how your weight is, and how your cholesterol levels are. So those are my pamphlets, and that is the end of my video. Thank you for watching.